Welcome back. I am Dr. Lee's AI speaking assistant of practical pain management. It is one of the videos that show how much rotation and tilting I need to find a target and approach the needle. Please check the cranial tilting and rotation in each procedure. I will show you a left L5 transforaminal injection with L5S1 and L45 facet joint injection, in case of left L5S1 foraminal stenosis, and L45 subarticular stenosis. It is a mild cranial tilting and neutral rotation C-arm image. The compass shows 35 degrees of left rotation. Let's begin. I have a narrow space of a safe triangle, so I do not have a choice but and go directly to the center of the triangle. I have to watch out for the inferior border of the transverse process and the lateral edge of the superior articular process of the facet joint. If the needle passes the deep fascia and muscle layer, I switch to a bare hand. Let me show you an AP view and a contralateral oblique view. The compass visualizes the contralateral 35 degrees. There is a long way to reach the final target point. I am supposed to advance the needle to the inferior 6 o'clock pedicle position. But, narrow disc space with protruded black disc displaces the nerve root upward and prevents further advancement. I will infiltrate the steroid mixture. I frequently ask the patient if he feels okay. It is one of the advantages of the inferior approach. Let me infiltrate the steroid and Botox mixture. Well done. Thank you for being so patient. Thank you for watching, and see you in the following videos.